Heart rate is another vital signs that healthcare providers can measure. The heart acts as a pump in our body and it pushes blood through the vessels. Every time that happens, a wave of pressure is being created, and we call that wave of pressure pulse. We can feel the pulse on the areas of the body where the blood vessels are passing in close contact with the skin. One such area is the wrist, and our fingertips are used to feel the pulse. Once you get a pulse rate, it gives the estimation on how fast the heart is beating. Evaluating the pulse rate gives us more information about the heart and the blood vessel, which together forms the circulatory system. The pulse rate is then recorded as number of beats per minute. A normal resting adult should have a pulse rate between 60 and 100 beats per minute. Exercise can increase heart rate, and by exercising, it means even walking from one point to another. That can also increase the heart rate. Therefore, before taking this measurement, make sure your patient is well rested for 10 minutes or more. Also, children have a faster heart rate than adults. A healthy, well-conditioned adult may have a pulse rate as low as 40, but otherwise that will be considered abnormal. Therefore, a high or a low heart rate is abnormal. Also, an irregular pulse rate is abnormal too. And if a patient has any of these abnormalities, a healthcare provider should be sought for further guidance. The pulse is best felt by using your fingertips. Use 3 fingers to press on the underside of the wrist. The blood vessel you will feel is located on the thumb side of the wrist. Use 3 fingers to press gently on the indentation on the thumb side of the wrist in order to feel the pulse. Try this on your own wrist and see if you can feel the pulse. Use a watch with the second hand and keep counting for 1 minute. Then record this number on a paper. Another way to measure the pulse is counting for 30 seconds and then multiply the number you get by 2 to get the number of beats per minute. However, if any time you notice that the pulse is irregular, continue counting for a full minute.